Wilmington Health, you asked for modern ways to communicate important information to you, and I'm here to deliver. I'm Alexis Hunter, your community liaison. If you've worked at Wilmington Health longer than through your orientation, you've probably heard the phrase value-based care. But do you know what it means? It's a big part of this organization, so it's important for us to shed some light on it so you can better understand how it applies to your role as an employee or provider at Wilmington Health. Simply put, value-based healthcare is a healthcare delivery model in which providers are paid based on patient health outcomes. Under these agreements, providers are rewarded for helping patients improve their health, reduce the effects and incidence of chronic disease, and live healthier lives in an evidence-based way. Whereas in a fee-for-service model, providers are paid based on the amount of healthcare services they deliver. The value in value-based healthcare is derived from measuring health outcomes against the cost of delivering those outcomes. Before value-based care was even a dream, doctors and hospitals received payments for the number of times they saw a patient and for the service they provided. A patient had a visit or a procedure. The provider collects a payment from the patient, then sends a claim to the insurance company. That payer sends a negotiated rate back to the provider, and that's that. These antiquated models do not emphasize collaboration or a relationship with the provider, and they can become very expensive. When there is no focus on outcomes, how will patients even understand what they're paying for? Value-based care saves everyone money and improves outcomes. That's why the Centers for Medicare and Medicaid Services, or CMS, originally came up with the idea of accountable care organizations, or ACOs. This type of organization places an emphasis on collaboration among all providers and the payers, or insurance companies. Providers are rewarded when they can keep costs of healthcare low while keeping outcomes high for patients. Outcomes could mean how often the patient goes to the hospital, how many medications they require, if they have access to care, if they are getting their screenings, and how well they rank us in surveys. Through this model, we have a select set of patients who are attributed to Wilmington Health. This means that if they've seen us for primary care or even more than any other provider, when patients are attributed to us, whether we like it or not, we have at least some financial responsibility for their care, depending on the agreement with the health plan. The health plan determines a benchmark for each attributed patient based on demographics and HCC coding. Over time, if we can keep the total cost of the patient's health under the benchmark amount, we at Wilmington Health are paid over and above standard fee-for-service income, which results in opportunities to incentivize Wilmington Health employees and providers and to grow our practice. The first thing we need to understand is how the benchmark is set. I want to give a broad overview, and if you have questions about details for this, there are folks that can go into that with you. But for the sake of simplicity, let's think of an example. Imagine that a woman, we'll call her Deborah, is attributed to Wilmington Health. Here's what's easy for the health plan to learn about her. She's 50 years old. She's a state employee. She lives in Pender County, and she has 2 children. She's currently taking medication to control her cholesterol. So we need to do all that we can to ensure the state health plan knows everything medical about her. When she comes for her PCP visit, it's important that we accurately code everything that will go out on that claim. That way, the health plan will be able to better set a benchmark for Deborah. Then we need to educate Deborah on how she can reduce her cost of care. We need to ensure that she's doing her routine screenings and that we are evaluating her prescriptions to ensure that she can afford them and that they're still appropriate. For example, maybe she's been taking the same cholesterol meds for a while, but there is now a generic available. By addressing that, we can cut costs for Deborah while keeping her outcomes high. After the amount of time determined, if we save Deborah money and her expenditures come out under her benchmark, those savings come back to us as revenue. However, if she spends more than her benchmark, that's a loss for us. And on some of our agreements, we have to pay that full amount back to the health plan. Now let's think about some expensive services. One of the best things that we can do is improve access for our patients so that they don't have to go to the emergency room. Actually, they call it the emergency department now, or the ED. But that's one of the most expensive places you could possibly go in almost any healthcare system. Tons of tests are run, hidden fees can be brought up. ED physicians are contracted through companies not even a part of a hospital system. And you may end up waiting for hours for a service that you didn't even need in a hospital setting. By offering our walk-in clinics like Today's Care, Urgent Care, and Today's Care Plus, we are able to offer our patients affordable acute care through a team closely linked with the patient's primary care provider. Another way that we can keep costs down while keeping patients healthy is discussing their prescriptions with them. When we approach their prescriptions with the mindset that we are responsible for the cost, it can change how we prescribe. For example, all of the bright, shiny new pharmaceuticals that are introduced to us through catered meals come at a cost. Often, there are generics that have the same outcomes. By keeping ourselves educated on both new and generic meds, and by utilizing our pharmacy team, we can ensure that our patients are taking the most appropriate medications at the most reasonable costs. These are just a couple of examples of how we can ensure we succeed in value-based care arrangements. Remember, value-based care means that we are paid out based on the value, high quality, reasonable cost of care we provide to patients. When we succeed at value-based care, Wilmington Health receives more revenue. That means employees get bonuses, higher budgets, more workforce, and a better place to call a job. And this type of healthcare, literally every penny saved is a penny earned. And don't forget, if you have questions, ask them. It's important for all of us to understand what we can do to make Wilmington Health a better place to work and a better place for our patients to receive care. Thanks for tuning in, and I'll be back again. Be kind and do good. Have a great day.